Welcome back to another episode of Black Phacts. Today we're going to be talking about, is racism a public health crisis? With Dr. Penny Marshare. She's a Deputy Director of Public Health with a specific focus on health equity and social determinants of health. She has over 20 years of experience in the community in public health, and she's also had 10 years of serving as an epidemiologist. So let's welcome Dr. Penny Marshare. And she's going to be helping us kind of unpack that and understand, what does that really mean? I know probably a lot of you have heard the coined phrase, being Black is bad for your health. I don't know how you feel about that. I know it kind of makes me feel a certain kind of way when I hear that term. So let's kind of get into it. Dr. Marshare, can you please tell us, why is racism a public health crisis?
You know, it's taken a long time for us to get to that point of being able to say it and acknowledge that racism is a public health crisis. What we have known and we've seen over the past, decades or so, that there are health inequities and health inequalities that exist. And what we've come to learn and understand about these inequities and inequalities is that they are tied to social experiences. And one very important social experience is how we identify ourselves by race. And so looking at our data, looking at disparities, persons of color are more likely to have these negative health outcomes. And the question is why? There are no genetic differences between racial ethnic groups. So why would being a person of color put us at a greater risk? And what we recognize is that our social experiences, experiencing racism, experiencing discrimination, that those not only change the way our body functions, so it impacts us internally, but it also impacts our mental health. It impacts us in so many different ways that ultimately result in our increased risk for chronic disease, increased risk for mental illness, increased risk, not an increased risk, but lower life expectancy compared to our counterparts. And so we're at a point now where everybody sees it, everybody knows it. It shouldn't be the elephant in the room. We should have good dialogue and important conversation, recognizing that racism in and of itself is a public health crisis, not just the chronic disease outcome as the crisis. Let's look down at more upstream at the experience that leads to the downstream outcome of increased risk of chronic disease.
Wow, you said a lot. So with racism being a public health crisis, and you're talking about how we internalize stress and discrimination and the macro aggressions that we face every day. What do the declarations mean? So I appreciate the fact that there's some acknowledgement, like you said, we finally addressed the elephant in the room, right? But what are these declarations that cities and counties are now signing and declaring, all across the United States? Yes, racism is a public health crisis. What does that really mean to Black and brown communities?
The declaration doesn't solve the problem necessarily, right? It's not all of a sudden going to change these outcomes that we've experienced for decades, centuries, tied to these differences and these experiences. But the important piece of the declaration is making it known and getting officials, city officials, county officials, state officials, national officials to recognize that racism is real. It's a lived experience. It stays with us and it impacts our health outcomes. And it's not just one person's way of taking something, one person's way of taking an experience, but this is a real lived experience for people across this country, across this world, and that this lived experience is impacting our health. So now we get to put people on notice. There's a crisis here that has been largely ignored, and now we need you to do something. And so these declarations are important, getting officials to recognize the importance of addressing racism.
Now you talk about getting officials to recognize that racism is a real thing. So let's take it to our medical institutions. Say I have not been accessing care the way I probably should because I feel, right, there's some racism happening when I go to see my provider. They're looking at me a certain kind of way. How can I maybe utilize this declaration as a talking point to engage my provider to say, this is how I feel and this is impacting my ability to access medical care?
No, that's a great point. And one thing that's happened out of these declarations, an additional piece, that you have healthcare providers that are now listening. they're interested in this as well because they see their bottom line's impacted, right? We're providing
Yes.
care to people for issues that we could absolutely prevent at a social level, that there are some social things impacting our community members that we're providing care for. So a larger number of community-based partners, organizations, and hospitals and healthcare systems are really interested in this conversation as well. And so when an individual goes and speaks to their provider, this shouldn't be something new to their provider at this point, right? They're hearing that these declarations have been made. Their organizations are engaged in these conversations. And a lot of healthcare providers are looking at diversity, equity, inclusion, and justice, which would not have happened without these declarations. That's one important piece of these declarations as well. It gets people on board to say, okay, what can I do to help? How can I address this? And when we talk about healthcare providers, I'm glad you mentioned that because we now have providers that are also looking around things like implicit bias and
Yes.
how that influences what they're doing. And it's unintentional. That's really important for people to understand that racism as a public health crisis is kind of this overarching umbrella that sets the tone for the conversation. And we then have to open it up and unpackage all of these elements and recognize that, people take it as you're saying I'm a racist. No, we
Right.
have structural racism embedded within our institutions and our systems, and it's not going to be something that we can quickly change. But if we all engage in this and recognize that there are implicit biases that we hold, and those biases influence how we engage with our patients, our clients, our consumers, our community. And those are the pieces that lead to this overarching area of racism as a public health crisis.
I have to ask you, you mentioned implicit bias a couple of times. Can you really break down what does that really mean? I know what it means. I know it's kind of a buzzword that maybe some of our viewers hear in their office settings, but what does that mean if now physicians, medical institutions are looking at their healthcare professionals that are providing services and taking them through implicit bias trainings? What does that mean?
Providers are looking now at implicit bias because they recognize, and there's a lot of literature out there supporting this, and there have been for years, that declaration of racism as a public health crisis was leading them to the direction of, okay, look at implicit bias too. Look at all these things that lead to the crisis that we're in. But implicit bias is really important. It helps us understand that the racism that exists is fueled by these underlying, maybe and oftentimes unintentional, but these stereotypes and these beliefs that we have about groups of people that influence how we engage people. So you may not step out and call somebody a name, right? You may not want to direct somebody a specific way based on their race, but maybe you don't put as much effort towards providing them the level of care and service that they so deserve. Maybe you don't recognize the influence behind the mannerism or your tone when you're engaging with them and how that directly influences the next steps that they take. And so getting people to recognize and understand that we all have biases,
Yes.
and not to assume that our biases are necessarily rooted in hatred or anger or intentional, but they are a part of who we are. And that's because of the experiences and the systems that we have in place. So how do we unpackage our bias? And how do we take a step back from where we are and say, there may be some bias around me in this conversation, and how do I remove as much of that as I can by recognizing that it exists as I'm trying to provide this person with the best service or care.
Okay. Would you recommend that as a person that's accessing that care, if I feel like, once again, my provider, I'm a little uncomfortable going to see my provider because I kind of feel like there's something there that I don't really like. I don't like you said, their tone or how they're addressing me. Would you encourage people to have open conversations and let their provider know, in a respectful way, of course?
Absolutely. Absolutely. I think people should feel comfortable saying, let's talk a little bit about what advisement you've provided me, because I'm not comfortable with that. And I want to make sure that you're providing me this advisement or this strategy or this option based on your needs, your interest in caring for me, and not based on your assumptions about who I am or assumptions about my practices or assumptions about my belief. So highlighting the fact that you want to make sure that you're addressing any assumptions someone may have about you, and you want to be open to having some dialogue and conversation around those assumptions.
And looking at it more like a partnership, this is your partner in ensuring that you're healthy. So you need to have those open conversations. So thank you for, talking about how we can do that in a respectful way. You also stated that really this racism is institutionalized. It's, it's in the very fabric of many of our institutions. Can you kind of give an example as to what that looks like? Because I think we use these terms and they're very general, but the general public doesn't really understand like how really is that affecting us, or how is, racism, systematic, institution, embedded in our institutions.
Absolutely. There are so many practices that we've engaged in across this country over time, right? And some of these practices may not be happening to the same degree they did before. You look at policies and practices around housing. Communities of color were supposed to be segregated and separated from other communities. And although it's not on paper, exactly, redlining is a great example of that, unfortunately. Blockbusting is another example of that. And although these are not policies that are in place today, practices still exist. That's the challenge, is that there may not be a formal policy that says still do this, but based on some of our biases, our stereotypes that we have about groups, we still engage in some of these practices. And so thinking about historical segregation as an example, our communities are still largely segregated. Yes. There may not be laws in place that require it as they have been in the past, but as a result, you've created communities that are segregated, and then resources are segregated.
Yes.
So then we don't have access to all of the same resources that maybe another community has access to, or maybe our community has more access to resources than another community. And so these are really important things to think about. We think about our educational system with our children. Mm-hmm. And we recognize clearly that there are gaps in disciplinary practices with children, particularly children of color. Mm-hmm. They're treated as though they're more based on the same age. If you have two children and one's a child of color, one's African American and one's a white child, and they're both the same age, but when it comes to discipline, we find that children of color are disciplined more harshly and are expected to know more, and are also treated as if they're more mature than their white counterparts. And so those are examples of, historically, there have been policies and practices in place. Today, there may not be formal policies, but there's still those implicit biases that exist that influence those practices.
Okay, I had a viewer ask me a question about racism, and I thought it was really good. So are there any laws that can kind of protect us if we experience racism?
Ooh, that's a good question. It depends on the setting, right? Because when you think about, where you work, are there laws that protect you against racism and discrimination in the workplace? Absolutely. Mm-hmm. Are there laws that protect you against discrimination and racism in educational settings? Absolutely, there are. Are there laws that protect you against racism and discrimination in terms of crime? Yeah, there are laws that protect you there. And are there laws that protect you against racism and discrimination in housing? There are. But there aren't laws against discrimination in the social experience that we have and the lived experience that we have. And so it's all about, how do we socially hold ourselves accountable and responsible for engaging with each other appropriately in a fair and equitable way, and one that teases out those elements of racism and bias that we're all victims of, but also we could be perpetrators of as well.
Thank you. Thank you for answering that. So Black people experience racism all the time. So why should we care about these declarations? I mean, yeah, it's nice, right? Again, for it to be acknowledged. But if there are no real tangible laws, I mean, there are some, but in our lived experiences, like you said, if there are no tangible laws or anything that we can kind of do to protect ourselves, why should we care about this and really kind of get behind this narrative?
I think about my children. And they're the next generation. And so when I look at the fact that the experience for a child of color from birth to death is so different than a child that identifies as white or is not considered a child of color, and that's not okay. And that's happened. We've improved. We've gotten better. Things have gotten better, but we're still experiencing racism and discrimination. And our health outcomes are not improving to the degree that they should be improving. So the way, all of us want to live, we want to live healthy, productive lives. We want to live lives free of illness, free of disability, free of harm. And the way we do that is by addressing this issue. As much as we feel, well, really, what can I do as an individual? There's a lot that we can do. engaging community. I've seen so many folks that are so invested in this work and invested in these conversations that are doing things and engaging with community partners that they never thought they would have, that are going down to board of supervisors and city council meetings to have discussion about these issues. Those things happen from a point of hurt that leads to this desire to see change. And that leads us to having these important conversations. But we're never going to see these things go away if we're not all engaged in the conversation. It can't just be a few of us. It has to be all of us that says this is not okay, because this could happen to any group. Any group could be experiencing what we experience as people of color. And so we want to make sure that we're healthy and we're taken care of, but we also want our brothers and sisters who identify differently to be healthy and taken care of as well. Because when we do well, we all benefit from all of us doing well.
Absolutely. I like how you suggested that we need to get civically engaged, go down and participate in our city council meetings, talk to our legislative officials that are representing us in our districts, because our voices have power. And if we're the ones who are voting them into office, right? So if we go down in, as a community and say, hey, we think this is not a good experience that we're having in our community. We're not having a good lived experience because of X, Y, and Z, and start talking to them about how we can make policy changes just to start improving our own individual communities. Just think about if we did that, locally, and everybody did that, had that, awakening about being civically engaged and participating in action. And we did that locally. If everybody did that, real change, real impact would happen on a larger scale.
Oh, absolutely. And what I've seen and have heard oftentimes is, you have people who are in political office who say, I thought there was something going on, but no one came to me. No one's showed up to our meetings to talk about this. No one's brought it to the floor for us to discuss. So often we think, oh, somebody else will do it, right? Somebody else has the same concern that I have, and they're going to be the ones to show up at the meeting and have the conversation. And maybe not. Maybe they're thinking the same thing that you are.
Absolutely. I think that was my response or my answer as to why should I care? Why should I care about these declarations? Like you said, first of all, because the generations coming behind us, we need our world to be better for them, right? So we need to stand in the gap and do the things that we need to do to ensure that their lived experiences are better than what ours were. Yeah. And two, the importance of, making sure your voice matters, that it's heard. We can't depend on this person or that person. Oh, that person's got it. No, it's our own individual responsibilities, right? To affect change. And again, I truly believe if one person, then that makes two, and then you talk to the next person, and we collectively go down and use our voices to make sure that, the people that are making these decisions and creating policies or amending policies, that, we start embedding in there, okay, yeah, this needs to change. So all of those institutional, policies that were laced with racism, that, like you said, some of them still exist, some of them don't, but we're still practicing them today. We want to see that change for our future generations. So absolutely. I would just, please invite all of our viewers to get engaged. Get engaged. This is the reason why you should be engaged, because we already know we're experiencing racism in our lived experiences. So we know it exists. It's nice that the dominant culture is now, acknowledging it, but now we in turn need to do something about it.
Yeah, absolutely. And I think about my kids, as I described to you a moment ago, and I want them to grow up and say, this problem has existed, and there are people in my life who knew and did something.
Yes, absolutely. So is there anything else you'd like to share with us on this subject matter? I know it's, like I said, it's something that is a burning, kind of desire in my heart to see real change happen. And I know change doesn't happen overnight. I know that it's going to take a lot of work with a lot of people, but I really feel very passionate about, this particular situation, because I am a public health professional, and I know you are as well. And to have that type of declaration come out really was kind of like, oh, wow. Okay. So there is acknowledgement that racism does exist. It is still pervasive to this day. So, any other words of wisdom that you'd like to share with us?
Yeah, I'd like to share that this work, many of us have been doing this work for years. And I remember starting working on health equity back in 2009 and never, I always thought we'd get far, right? But never thought we'd get to a point, not in my time, that I'd see a point when we had our board of supervisors making a formal declaration. That's huge. We need to capitalize on that. We
Yes.
need to use that. We need to ride that wave as far as it will take us into removing and disbanding and breaking up the experience of racism for our populations and for our communities. And so I think this is an amazing time. It really is. I mean, this is huge. This is not something that I thought would happen. And we're here. And so instead of taking a moment back and taking it for granted and just saying, oh, well, what can I do? Is there anything I can do? There's a lot that all of us can do. And there are so many wonderful community partners like yourself that are doing this great work. And so engaging with you, engaging with other partners like you is what we need to do.
Thank you. Thank you. Yes, I feel like it's important, and I so appreciate you saying that we need to capitalize on the moment.
Yeah.
The right time is now, right? Let's ride this wave. Let's make sure that we see some, even if it's just small incremental change.
Yeah.
Let's work together collectively to make sure that, things are better for our future generations.
Yes. Yeah.
Well, thank you, Dr. Marshare. I so appreciate you coming on and talking to us about why we should care about racism being a public health crisis.
Oh, thank you so much for having me. I really appreciate your time with me today. And I look forward to engaging with you again soon.
Absolutely. Absolutely. Thank you for joining us on another episode of Black Facts. I want to also thank my guest, Dr. Penny Marshare. She really enlightened us on what it means for racism to be a public health crisis. And I'd like to hear from my audience as well. So please like, share, and comment down below and let us know your thoughts on racism being a public health crisis. Have you had any thoughts? Are you doing anything? Are you getting civically engaged in your community to try to make an impact or change that narrative? Make sure you like, share, and subscribe down below and leave that comment and join us for another episode so we can all know the facts. Take care, everyone. See you next time. Bye.